Hello everyone, welcome to the class of surgery course delivered by China Medical University. Today I'm very glad to let you learn the diseases of the breast. There are a lot of diseases of breast, and I think I can talk the whole day about this. So I'll deliver a general vision of the breast. The first section, we'd better learn from the anatomy and the breast development and physiology. First, the breast is a shallow organ which lies between the subdermal layer of adipose tissue and the superficial pectoral fascia. Between the breast and pectoralis major muscle lies the retromemory space, which contains lymphatics and small vessels. The breast parenchyma is composed of lobes that in turn are compressed of multiple lobules. There are fibrous bands that provide structural support and insert perpendicularly into the dermis, which term the suspensory ligaments of Cooper. And this is a concept I think you should master because it is closely related to a very important symptom of breast cancer called skin dimpling. Okay, next I'll show you the microanatomy of breast. The mature breast is composed of three principal tissue types: the glandular epithelium, but they are not the majority of the breast, and fibrostroma and the supporting structures, and adipose tissues. In postmenopausal women, the glandular structures involute and are replaced by adipose tissue. Each of the major ducts has progressively generations of branching and ultimately ends in the terminal ductus or acne. The acne is the place where milk is found. We also call it terminal ducts. It is the very important place because a lot of disease originated here. This is a special examination called ductography. And the picture, we call that ductogram. It's a method used to evaluate nipple discharge. How to do that? By injection of contrast into a single ductal system and then take a mammography, the X-ray examination of the breast. This ductogram showed the entire ductal tree from the retroareolar duct to the lobules at the end of the tree. And this is a healthy ductal tree. You can see the major duct and the lobules very clearly. It also demonstrates the functional independence of each duct system. There's no cross-communication between independent systems. The tumors in the duct results in filling defect. You can see a cut here and the structures under it disappeared, calling filling defect. The next section is very important in this slide. It's the anatomy of the breast, including the blood vessels, the lymphatic nodes, and the nerves. Most important is the lymphatic flows of the breast. Breast is abundant of lymphatic channels, and it's tricky of the lymph nodes in the breast, cause the lymph nodes from the skin to the subareolar plexus firstly. It is also called sepiplexus, and then into the interlobular lymphatics of the breast parenchyma. First, the subcutaneous, and then into the parenchyma of breast. Of lymphatic flows from the breast, about 75 is directly into the axillary lymph nodes. A minor amount goes through the pectoralis muscle and into more medial lymph node groups. A major route of breast cancer metastasis is through the lymphatic channels. The regional spread of cancer is important to understand to provide optimal local regional control of the disease. The axillary lymph nodes are typically described as three anatomic levels, defined by their relationship to the pectoralis minor muscle. Level 1 nodes are located lateral to the lateral border of the pectoralis minor muscle. Level 2 just located behind the pectoralis minor muscle. And level 3 include the subclavicular nodes, which lies medial to the pectoralis minor muscle. There also have the additional lymph nodes which not belong to axillary lymph nodes, for example, the supraclavicular lymph node and the internal mammary nodes, which is also be seen as the local lymph nodes groups of breast. And the internal mammary nodes, a few proportion of people will drain a lot of lymph flows. There are two major nerves in axillary, and you will meet when you're doing the axillary dissection. The first one is long thoracic nerve, which innervates the serratus anterior muscle. Division of the nerve may result in the wind scapula deformity. The second important is the thoracodorsal nerve, which innervates the latissimus dorsi muscle. There are also a lot of sensory nerves which mutated a lot. So, in charge of the feeling of the chest wall and the upper limb, and division of the sensory nerve will cause the numbness of this area. The next I will introduce the physiology and development of the breast. First period is the childhood. In this period, breast is composed primarily of dense fibrostroma and have no function. The second period is the puberty. It is the period breast hormone-dependent maturation begins, and the increase of deposition of fat, the formation of new ducts and branching and elongation, and the first appearance of lobular units. This process is under the control of a lot of hormones. Most importantly is the estrogen and the progesterone. And then enter the next step, the childbearing age. The mature or resting breast, the resting breast refers to the breast not in the period of pregnant, contains fat, stroma, lactiferous ducts, and lobular units. During phases of menstrual cycle, in response of exogenous hormones, the breast epithelium and lobular stroma undergo cyclic stimulation, which can produce pain and breast engorgement. I think in the histology lessons, you have already learned about that. The change of breast acne during menstrual cycle show this process is hypertrophy and alternation of morphology rather than hyperplasia. So it is a physiologic process, not a pathologic process. In the late luteal, we also call the premenstrual phase, there is an accumulation of fluid and intralobular edema. During this period, women always feel a little edema and the hurt of breast. And in the outpatient, a lot of people are very anxious about this. During pregnancy, there is a diminution of the fibrostroma and the formation of new acne or lobules, which termed the adenosis of pregnancy. And after birth, sudden loss of placenta hormones combined with continued high levels of prolactin triggers the lactation, and it's a magical process, I think. The last step is the menopause. There is an evolution and a general decrease in the epithelium elements. the increased fat deposition and the diminished connective tissues, and the disappearance of the lobular units. But it is also a phase that tumors emerged. Okay, this is the end of the section 1, and I will be very happy to see you in section 2.